Hello, my name's Ian Graham and welcome to myndTFT. High blood pressure is the single greatest risk factor for heart disease and stroke, and bringing it under control should be everybody's priority. More often than not, lifestyle changes such as losing excess weight, exercising more and eating healthily can bring it under control quite quickly and naturally. However, for some people, their blood pressure remains high. By teaching you a very simple myndTFT technique to bring your stress under control, and another technique to rebalance your blood pressure control system, we can help bring your blood pressure down into the normal range. You should understand that this technique does not work with everyone. However, it does have a high success rate. You should ensure, of course, that you consult your physician for any risk to your health, including high blood pressure. This is especially the case if you are pregnant, if you already have existing heart disease, or if you're taking medication for high blood pressure, high cholesterol, or anything else involving your heart and circulation. If any symptoms persist, of course, such as headache, shortness of breath, or dizziness, you should again seek the help of a medical professional. You should never take that decision yourself. Before we begin, you will need to sit in a comfortable position and take your blood pressure by whatever method you already use. It's very important that you have a reference reading, and home testing machines provide this easily. Keep a note of the value, for example 160/95, and you can then compare before and after readings to see if the treatment has brought your blood pressure down. We now need to get your thoughts focused on your high blood pressure problem, so bring it to mind right now. Don't focus on how it has been in the past, nor how you think it might be in the future, but how it is right at this precise moment. Let's begin. Firstly, we'll correct for psychological reversal, a possible block to success. Find the fleshy part of the side of your hand between your little finger and wrist and give it a firm tap about 20 times. Now, using the tips of 2 fingers, tap the beginning of your eyebrow on either side of the bridge of your nose. Next, tap under your eye. Now, tap the tip of the tiny finger. Locate a tapping point on the back of your hand just behind your ring finger and little finger knuckles. Tap this point constantly. Finally, the collarbone points. For the next part of the treatment, you need to keep your head in a fixed position, straight and level. Locate a tapping point on the back of your hand just behind your ring finger and little finger knuckles. Tap this point constantly while I take you through the next procedure. Remember to keep your head straight and level. Now close your eyes. Open your eyes. Look down to one side and down to the other. Now roll your eyes round in a big circle and round again in the opposite direction. Now count out loud. 1, 2, 3, 4, 5.
1, 2, 3, 4, 5.
Hum a few notes of any tune. and count again.
1, 2, 3, 4, 5.
Now you can stop tapping, ready for the next part. Using the tips of 2 fingers, tap the beginning of your eyebrow on either side of the bridge of your nose. Next, tap under your eye. Now, tap the tip of the tiny finger. Locate a tapping point on the back of your hand just behind your ring finger and little finger knuckles. Tap this point constantly. Finally, the collarbone points. Now that your stress level is significantly reduced, we can fix it in place with one more procedure. Once again, locate the tapping point on the back of your hand just behind your ring finger and little finger knuckles. Keeping your head in a fixed position, straight and level, begin tapping that point and then turn your eyes downwards to look at the floor. To my count of 10, keep tapping that point on the back of your hand and roll your eyes slowly upwards so that you're eventually looking at the ceiling. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.